So, hi everyone. My name is Mary Keefe. I am happy to see many of you again on this session. Thank you so much for joining us to hear about our public Office of Public Health practice at the Yale School of Public Health. I'm going to turn it over to our director, Susan Nappy, in a minute. I hope you have found the events that you've attended so far helpful. And as you know, these are all being recorded, so we will post these online for you to view at your convenience. And I'm going to stop sharing my screen now, Susan, and turn it over to you.
Great. Thank you so much, Mary. It's great to be with you all in this strange new space. Normally, I would get to see you in person, and this is as good as it's going to get right now, but I'm very excited to share with you my insights, not only as the Executive Director of the Office of Public Health Practice, but also as a graduate of the program, and basically discuss practice and what it means sort of as a cornerstone of your time at the School of Public Health, and also maybe some questions to help you discern as you're making decisions around where you're going to choose to go for your graduate studies. So I'm going to share my screen. And hopefully everyone can see that. Can you see that?
Mm-hmm.
Awesome. Okay, great. So we're very fortunate at the School of Public Health because we have an Office of Public Health Practice, which is not every school has one of those. Tonight, we're going to just spend a little bit of time talking about what who our office is and what it is and what we do, how we engage, because that's the cornerstone of practice is engagement, community engagement, a little bit about New Haven, and then practice at the School of Public Health, which is why you're here. And then a few sort of points about why practice at the Yale School of Public Health. And I hope to leave it open for questions. And I do have some frequently asked questions that we get. And then at any point, you could put a question in the chat, and I'm going to try to leave questions to the end. Okay, sorry, my screen's a little slow. Okay, so this is our team. They're going to slowly join us. So the Office of Public Health Practice is comprised of a small team and several research entities, as well as Innovate Health Yale. So our faculty director is Rafael Perez Escamilla. Our deputy director is Kathleen O'Connor Duffany. Kaveh Kashnood is actually the faculty director of Innovate Health Yale. And then underneath you have, I'm there, as well as Kathy Tra, who's the New England Public Health Training Center director, Fatima Bezrai, who is the program director for Innovate Health Yale, Chandra Kelsey, who's our newly minted Office of Public Health Practice Manager, and we also have Anjali Bodak, who runs the Global Health Concentration. So all of that sits under the umbrella of the Office of Public Health Practice. And that becomes very important because we actually serve as a hub for practice. And that's what really makes us unique, because we have a lot of research entities where applied practice research is conducted, and it provides a nice space for students interested in a hybrid of evaluation and research as well as pure practice. Okay. So I really wanted to just ground us first in the vision and the values of our office, because we really feel at the School of Public Health that our practice needs to be grounded in an equitable framework. So we overhauled with a strategic plan last year. I'm not going to read these out. You can look at what we stand for, but really our overall vision is that all of our experiential learning is mutually beneficial, it's anti-racist, it's equitable, and I didn't add here, but I always say community-centric, and it's focused on cultivating health and wellness as well as being fully resourced. So really what we're trying to do from an equity perspective that you should know is we're really focusing on fully funding our practice opportunities. So I'll talk a little bit about what we've been doing to try to make sure that we don't have unpaid internships. Okay, so again, just grounding us, the how is that that our experiential learning and our practice, our community service is community centric. We honor local knowledge and contributions. And I always say we try to flip the paradigm so that students are engaged in activities that the community deems as valuable, important, and meeting their needs. So often you get excited, you want to go out in the community, you want to do this great work, you want to apply your knowledge, and the community's already been doing things. You could be going in the community, they have a long-standing, say, violence prevention strategy. And it really is about figuring out what community needs are already identified, and then ensuring that you are complementing that with the skills that you bring to the table. Collaboration and partnership are central. All of us in the team sit in community committees, sit on community committees, state committees, global committees, and we ensure that we're bringing back the expertise from those groups to our students, and we very easily and readily connect students to practice opportunities. Some of the what is that we have ongoing listening and collaboration, as I shared. An example of that is I've been sitting on the steering committee with Marcella Nunez-Smith, who's actually currently with the Biden administration. I've been sitting with her on the Center for Research and Engagement Steering Committee for 15 years. And over those 15 years, we've spent a lot of time together figuring out community engagement strategies and coming up with practice opportunities that are really focused on community need. We have a project pipeline approach where organizations come to us with opportunities and we see if it's a better fit for a practice course, an internship, a research initiative, and sometimes community service. So there's multiple ways to get connected that I'll share with you a little bit later. I also work with organizations to co-create projects. So I sit with them, we talk about what would make sense for student engagement, and we craft a project, and I try to find individual organizations maybe that have never partnered with an academic institution, and really I try to serve as a capacity builder. We also have a health equity fellowships. We started that several years ago, where we fully fund a student to work in the local community on a research initiative or a practice initiative that's been identified by the New Haven or Greater New Haven community. So just to orient you to place and space and why it's valuable and important to see where you're located, you probably have done some research on New Haven, but Yale is not the only academic institution in town. So this really shows that we also share this space with Albertus Magnus, Southern Connecticut State University, and Gateway. I also will share there's UNH, there's Quinnipiac, which is in Hampton, and I actually sit with these institutions in a experiential learning committee, and we really try to share projects. So if I come up with projects that students maybe there's no uptake, I try to share and get those projects allocated to other institutions. And that way the community feels like we have their back and we're really trying to help them with their wellness and health initiatives. Again, some more information on New Haven. It's a relatively mid-sized city, so we have about 130,000 individuals here. And this is just some statistics from the US Census, just to sort of orient you to what it looks like in the city. I should also share that I think that it's probably has the most nonprofits in a city this size, because many of Yale graduates go on to develop their own nonprofits after they graduate. So as I shared with you, partnership is central to what we do, and this is just a sense of some of the community organizations, academic partners, government entities, companies, and healthcare organizations students have been placed in these organizations. So now we want to talk a little bit about applied practice. And I can share a little bit about my journey at the School of Public Health. When I was at the school, I took advantage of multiple practice opportunities. I not only worked on a community needs assessment at the Yale Griffin Prevention Research Center, I also had I worked there, and then I had an internship there, and upon graduation, I had a job there. So really there was this opportunity for me to take my practice experience and develop a career. And it really shaped the trajectory of my entire public health career. I went on to work in healthcare at the same hospital where the Yale Griffin Prevention Research Center is located. And I found myself back in research at the School of Public Health. And now I'm managing the activities of the Office of Public Health Practice. Throughout this entire time, I really saw practice as central to my education and also as really formative to becoming a public health practice professional. And so when you're looking at programs, you want to sort of get a sense of what is their definition of applied practice and what is it that they're hoping to achieve through that. Certainly there's careers. You want to definitely look at getting practice skills that can get you poised for a public health career, but it's also really practice grounds us in our knowledge and skills that we're learning that we would like to apply. So this is actually a picture from a student from my class last year who took his nonprofit, Cocoa 360, and really focused his efforts, and his name is Shadrach Grimbong, which you probably should look him up because he's really got a lot going on and he's doing a lot of activities focused around equity. And really what he showed was that he had to take what he was currently doing, like we all did, and pivot to address COVID-19. And so this is and he did that in our practice course. Okay. Okay, so practice at our school. So these are the ways that you could have practice experiences. And I really like this Venn diagram. I created this last year when people were getting very confused. What's the difference between an internship and applied practice experience? And if you choose to come to the school, you'll hear me talk a lot more about this. But essentially, there is the applied practice experience, which you are coming to an accredited school. And if you are coming to an accredited school, you have to do an applied practice experience. And so typically what students in our at Yale have done is they have met their applied practice experience through their summer internship. Well, guess what? When COVID happened, we realized we got to really think about this. We got to really get creative, and we have to make sure that we're meeting the needs, the practice needs of the students, as well as meeting the needs of the accrediting body, which is CEEF. And so what we did was we made sure that we split apart the applied practice experience and the internship. I'm imagining that many of you will still meet your applied practice experience through your internship, but you don't have to. We also have practice courses. At any given semester, we have about 6 to 8 practice courses, which is actually quite robust. We also allow for community service to be practice opportunities, a pre-approved community service activity. A lot of students met their APE through contact tracing this past semester. And then we have a variety of student groups within the School of Public Health, as well as across Yale. So a lot of students will not only conduct a robust applied practice experience, an internship, but they may be part of the student consulting group, which is a year-long practicum experience. So while you're here, definitely take advantage of all of those connections and opportunities because there are many. This is just a sense of our past placements. We're still looking to gather our 2020 data. This is from 2019. You see that about a third of our placements have been in healthcare, which is not surprising. We have Yale New Haven Hospital is one of the biggest healthcare systems in the state. But a variety of individuals, we have NGOs, university placements, as well as government finance consulting. And we just this past year, adopted a Salesforce platform. So we're really going to be slicing and dicing these data in a variety of ways. And we've added a lot of equity metrics to that. So the next year, you'll be able to see sort of where all the placements were and a lot more in-depth data around these placements. So then, why would you choose the School of Public Health? Well, of course, I'm very partial, and I graduated in 2001, so quite a bit ago. And over those 20 years, I've managed to see our school really grow and change and really adopt a very community-centric approach. And I'm very proud of that. And that was one of the main reasons why I was attracted to come back and lead the office after spending so much time away from academia. I really felt like a true public health professional and practitioner, but I was attracted to what's known as a research school because I saw the dedication of our faculty and our leadership around this. And we also have practice innovation, which I think is extremely unique for a school. As I shared with you, Innovate Health Yale sits right within the Office of Public Health Practice. And this past year, I'll give you a great example of innovation. We were approached, as all of us were, to really work on the COVID-19 response. And we managed to work with Saliva Direct. And if you haven't heard of Saliva Direct, they're actually the team responsible for the testing strategy with the NBA. And they're actually a very cheap and effective saliva test for COVID-19 that actually is resistant to the mutations. So essentially they could pick up COVID even with the variants. So we were approached because they had the science, but they didn't have the practice. And we were asked to work with them to develop a strategy to intervene in communities. So that's in practice, that's an innovation. And now what we're doing in the city of New Haven is we're ensuring that all of the learning hubs in New Haven, which is an alternative method for students who don't want to go to schools, for them to continue learning in these learning hubs, we have a robust testing strategy that's going on in New Haven. So what happened was the scientists, bench scientists said, we don't know who to go to. We don't know who in the city we should partner with. So right now we have 2 organizations partnering with Saliva Direct, and we are the intermediary. And that's exactly what we do in public health. We may not be the experts in everything, but we have to make it work, and we have to espouse a systems approach and a systems lens. So our office is really right there, also doing these practice activities. And what was great about that was, we didn't have to be PIs on a grant because that takes away from your time and practice. So we helped incubate this, and now that group is actually going to be hiring their own practice team. So in that 3-month interim, or now it's actually 5-month interim, what if they were waiting to assemble their team, they wouldn't be able to be so quick and nimble on the ground. So that's kind of what I think is a unique aspect of the School of Public Health, is that we kind of sit in a great and centralized location where we kind of can combine the best of both worlds and really have a nimble approach to practice. We also have long-standing relationships, local, national, and global partners. And as I shared with you, there's multiple practice opportunities tailored to your interests and career goals. I mentioned the practicum course options. You can go online and see all of our practice courses. And I also mentioned the student organizations. Just wanted to share a few anecdotes from our students. Really, when I read through these comments, they're very helpful. And we hear a lot of the same things, which is basically these practice opportunities really help me grow as a professional. Actually, I'm learning that, and I try to encourage students to do something that's completely out of your comfort zone, because as you're learning new skills and you want to identify a career, maybe it's useful for you to be in a different area of public health than you might think that you would want to do as your career. And one of the main reasons I actually came to the school was because I knew that I would have a strong framework in evaluation. And evaluation is essential to public health practice. And I'm learning that now. We actually have a lot of strong evaluators at our school. And really, public health practice is all about assessing impact and operations. So I really feel like that helped me in my career, and that really came through in my practice experiences. So I have a few questions, but of course, I want to open it up right after this. So also, as you're thinking of questions, feel free to put them in the chat. So community service hours. So I shared earlier, they're not required, but of course you have to do an applied practice experience. What I found last year, I did a poll of students, and we had over 3,000 hours of community service in addition to practice. So really our student body tends to be extremely connected and really service oriented, which is wonderful. Oftentimes I think, I don't know how everyone has time for this, but we have a really active student body. And so if you want to do community service, you can do that. And I have a strong partnership with the United Way of Greater New Haven. So I often connect students to them if they want to do on the ground community service. So of course, you still want to have your ideas. You come, you'll have ideas about community service, about how you want to partner with community. That's really great. But I also encourage students to come to our office to see maybe someone's already doing it or thought of it. And also, we always try to ground when we're doing community work in the why me and why now. So, asking yourself these questions and reflecting on sort of what you bring to the table with service and practice is definitely something we try to cultivate in our students. As I shared before, you can find your own volunteer activities, but we like to work with our local partners. A little side note that when COVID-19 sort of really we became aware of this in March, we were working with the United Way to try to do a summit on experiential learning. And they said, you know what, we don't want to do a summit right now. Our organizations are just, we can't do this. We have to focus. They're stretched and they can't, serve their clients. And so I said, well, would you be willing to host a portal that's specific for COVID-19? And they did. So what I then did was we galvanized all the academic centers and we basically said, go to this one portal. And so through that one portal, millions of dollars and resources were redeployed in Greater New Haven. So that's really the value of these partnerships. And I hope to work more closely with them to identify individuals with lived experience to help us with volunteer training and engagement. Okay, so now I did that rather quickly, but hopefully I didn't think any of us wanted to be on Zoom for a full hour, but I want to open this up for questions now. I know, everyone's so tired. It's always stunned silence. I don't feel that bad because I just got off of a Zoom call and Anthony Fauci was on it and people they only wanted to know questions about what it was like to work with Donald Trump and they weren't going to let him answer those questions. So I don't feel that bad if you don't have questions because even Anthony Fauci didn't have a lot of questions.
Anthony Fauci is our commencement speaker this year, by the way. That was planned well before COVID, so very exciting. Yeah.
Very excited, yes. And I have my Fauci doll, so yeah, he's making an appearance.
I love the Fauci doll. Question, if that's okay.
Yes.
My name's Jordan. I wanted to get clarification. I had to jump in a little bit late from work. So the applied practice experience could also be an internship, is the same as the internship, but you don't have to have an internship, correct? Like you could just do community service and apply that towards the applied practice experience, or could you explain that a little?
Absolutely. And you know what? Our faculty are still getting this straight. So this is the perfect question. Hopefully, we're getting this all straight because there are so many opportunities but let me just clarify. Our school actually has two requirements. An internship is required and the applied practice experience is required. Now, most students, they just do an internship that meets the applied practice experience. So if your internship has community engagement, it meets 5 competencies and it produces 2 deliverables, then you can count that towards your applied practice experience and you do one thing. Now, sometimes people say, I have this amazing consulting opportunity this summer and it doesn't have community engagement. Well, we're not going to tell you no. We're going to say, that's wonderful. Do that consulting thing and come back to me and we can find a practice experience for you through a practicum. And right now we're allowing community service. In the future, we might not. I mean, this was really a COVID specific thing, but right now we were allowing contact tracing and a pre-approved community service activity. Does that clarify your question?
Yes, the Venn diagram is coming back to me. So essentially the internship could kill 2 birds with 1 stone, but it doesn't have to. Okay.
Right. Let me find the Venn. I created a Venn here too. So
Okay.
Yeah, that's that. And like I said, so some students are perfectly fine with knowing that they have to take a practice course. And the practice courses typically, most of them are in the spring, but we do have a couple that are in the fall and they're great. They're very robust, but often you'll work with a team of students. It's very rare that you'll work individually in a practice course. Usually it's with 2 or 3 other students. Okay, I think I see some other questions in the chat. Okay. Okay, so great, a dual degree. I have 2 summers. Which one do you recommend? Yes, so it's typically after your first year. That's when we would recommend it. So I would imagine, yeah, and is it possible to do an internship? That yes, I think so. I mean, I'd have to talk to you about your individual situation, Rebecca, but I think so. Okay, yes, there is overlap between OPHB and the career office. Yes, and I do, and I have I didn't put up my slide with the then with CMC and OPHB. I got to do that for the next one. But essentially, we help with making sure that you meet the applied practice experience requirements. What the career services does is they help with, because they are the ones that manage Handshake. So they are actually the ones that manage your internship placements. Oftentimes what happens is Kelly Shea will say, okay, there's these placements on Handshake, and she'll say you want to connect with the Office of Public Health Practice to make sure that this internship meets your applied practice experience. So we complement each other, we work together, we often will kind of dually consult with students. So the student who is going on to the Handshake platform and sees this amazing internship, they'll flag it and they'll come to us and fill out a work plan and say, does this meet the applied practice experience? So that's kind of how we work together, even though we use 2 different platforms. My hope is in the future we use one platform and all of us are on it together, but you know how these things take time. I hope that answers your question. Sure, that's great. So the practicum courses we have, and what I can do is in a little bit I'll put the link for you. So the practicum courses are usually focused on department areas. So we have a healthcare management practicum, health policy practicum, and we've got 3 courses that are public health practice. We have one in evaluation, we have one that's focused on community engagement, and then the course that I teach has been mostly for those students who are in the accelerated program. So those are students who aren't going to do a summer internship, but I found that this semester I had a lot of other students, like biostat students, that were taking our course that was public health practice. So essentially, I'll give you some examples of some projects in the practice courses. So I came up with about 13 projects this semester for our students, and they ranged in things like creating a heat map to assess broadband capacity in vulnerable communities. So we were looking at historically underserved and underrepresented communities and whether broadband availability was the same as in other communities. Now we knew it wasn't, but we wanted to create a heat map because what would happen then is corporations could intervene and provide better connectivity so that those individuals in those communities could actually access healthcare, online healthcare. So something like that, where somebody with a biostats major and data visualization skills really worked on that project. Another initiative we had was there is an international company called Levo International that actually is domestic and international. And they've created a hydroponic kit that actually has been used in Haiti, in Hartford, and in New Haven. So they're trying to address food insecurity and actually create a financial model so that individuals can sell excess vegetables. So they created this great hydroponic kit, but they haven't tested it yet. So they know anecdotally that it works, and they wanted to develop both a needs assessment framework. So where do we place these things? What kind of rubric do we want to use when we decide where we're going to place the hydroponic gardens? But they also wanted to develop an assessment of impact. So what happens once an individual or community gets these hydroponic kits? So that's an example of something that was around food security. And we've also had, we have individuals working in the New Haven Health Department right now with vaccine distribution. So that could have been a community service, but what they're doing is they're adding on top of this individual's a physician, and he's adding on top of this sort of a compendium or a PowerPoint of how best to roll out a vaccine distribution plan in a local health department. So those are sort of 3 examples that are very different, but we're all represented in this course, and worked, and several teams have been working on these initiatives. Great. Any other questions or thoughts?
Hi guys, can I ask a question here?
Sure.
I'm sorry I'm jumping on late. I just come back from the vaccination site. Sorry, I just finished my working. So the question probably already covered by other students. So my question is, I saw there's a course, it's called practice experience or something. So if I have my internship during the summer, that's gonna be counted as the like practice experience course? And also for, I don't know, is there's like, I know is there a requirement for students to have an internship, right?
Yes. Yep. So there is, both are requirements. So the internship and the applied practice experience are both requirements. So and it's okay, because this is a great point of clarification that I can say several times, because it takes a little bit of time to get it. That if your internship is a consulting internship placement, and it doesn't have community engagement, and it doesn't produce 2 deliverables, and it doesn't meet 5 competencies, then it's a pure internship and not an applied practice experience.
Okay.
So then you would have to take a practice course or work with our office to have some other activity that would count towards your applied practice experience.
Okay, that sounds good. And also the career service gonna be like help me getting one, maybe get a internship that's meet the requirement for all those course, the practice experience, right?
Yes, and what happens is when you become a student here, in the fall, we do a dual presentation with the Career Management Center to talk explicitly how you find placements, where to go for the internship platform, how to create your work plan. We have a very good timeline. And we're not to say that we're not, you can find your placement wherever you want, but we really try to guide the process. And there are lots of students who they're saying, I don't know exactly what I want or where to go. So you could work with either our office or the Career Management Center to kind of help you think about your career goals and also sort of your passion in public health.
Sounds good. Thank you so much.
You're welcome. Someone asked about getting involved in New Haven if you can't physically be there. Yes, I had a lot of questions about this. Well, fortunately and unfortunately, we have a lot of remote opportunities. So all of the health equity fellowships that I crafted this past year, co-created with our local organizations, were remote. So if in fact you have a passion or there's something you'd like to do with an organization, I'm happy to work with you to get connected to New Haven organizations. There are plenty of opportunities, and there are so many needs that organizations have. I actually just crafted a project with a group called All Our Kin. This is an example where they had a need. All Our Kin really focuses on developing family child care centers, and why that's really important is that really develops self-sufficiency for a lot of women from low-income backgrounds and a lot of Black and brown communities. So they really have established this great model and network, but a lot of those women cannot reopen because of COVID, or they have fears and there's vaccine concerns. So what they've asked me to do was get a student who could work remotely on curating resources for them that they could put on their website. So that's something that you can get connected to. That's the New Haven organization. And if you wanted to dedicate some time or actually craft a project out of it, that would be something that you could do remotely. So I'm finding more and more of those opportunities. You're welcome. Any other questions?
Hi, I was wondering, well, let me back up. So you spoke today a lot about innovation in health, and I know that the Yale has the Innovate Health program, and we heard about that earlier today. I was wondering how the Office of Public Health Practice ties into that initiative, and specifically with kind of entrepreneurial projects that might just crop up within the cohort.
Yeah, so the beauty of that is that they are located within the Office of Public Health Practice. I actually work very closely with Fatima Bezrai, who is the program director. And so a great example, just recently, we had an entrepreneur contact us with a mental health app that she had developed, and she was looking for a student team. So Fatima connected with me and she said, "Who do you know?" And I put out a request to students, and we actually were able to get a student group to work on that app. So because of our proximity and our relationship with IHY, we actually work pretty seamlessly with them. For those students who are very interested in the innovation and sort of those entrepreneurial projects, that's really her side of the house. But my side of the house is really connecting the students. So it actually works very seamlessly. And I think it's what makes our school pretty unique.
Awesome. Thank you so much.
You're welcome. Okay, any other questions? This is great. You guys make talking at 5:30 easy.
So do you guys. This is great.
Good, glad to hear it. So I'm going to put my email in the chat because I'm sure things are going to come up. And I talk to prospective students one-on-one, happy to meet with you, share sort of thoughts about programs and your journey, because it's a lot to think about. So feel free to reach out to me. And I'm actually also going to put in the chat, we recently, that I think is actually pretty cool, we actually have a brochure that was created that shows sort of our COVID response and what the school was able to do, because all of us pretty much quickly pivoted and galvanized all of our resources. So I'm going to put that in the chat if you're interested in seeing the response to the pandemic. One of the things that's not in there is our team. Kathleen O'Connor Duffany actually helped with the emergency food response in New Haven, that we were able to serve over 2,000 families with a pantry to pantry program. And Kathleen is actually the director of the Yale Griffin Prevention Research Center and the co-director of the Community Alliance for Research and Engagement. Jordan, you had another question.
Yeah, this might not be the best. I'm not sure if this is the best info session to ask this. So if this is more appropriate for a different info session, please let me know. But I'm kind of, as I'm considering a bunch of other, or a couple other schools, one thing that I'm really looking for is like applied practice, into teaching as well. So obviously this is a really great opportunity to apply what we'll learn in the classes and in the courses. Can you also speak to the courses? Are there a lot of applied skills that we're going to learn there, or are the courses more focused on research? I'm not sure if that's a very clear question, but I'm kind of looking for a program that also incorporates that throughout the classes, if that makes sense.
Definitely. So I know that there are qualitative methodology. There's a lot of courses you can take that teach you some of the primary skills. So qualitative methods, and of course you're going to get a very strong background in quantitative methods. I would say that the practice courses teach you a lot of applied practice skills. I know that there, if you look, and I'll put the link on, if you look at our practice courses, you definitely get the full gamut of systems thinking. The essential services of public health are definitely embedded in those courses. And now that we have the U.S. Health Justice concentration, a lot of those courses are now going to be offered through that concentration as well. So, and yeah, I'm sure you'll be learning more in other sessions, but I felt like I learned, even from the time I've graduated, there have been enormous strides in the practice skills arena. Does that answer your question at least a little bit?
Yeah, that's very helpful. Thank you so much.
You're welcome. Okay, anything else? Okay, well, I think I'm going to be giving you an extra 20 minutes of your time back. Feel like that was fast and furious. Unless, Mary, there's anything else you want me to cover or discuss?
No, I just want to be sure before we sign off, if there's any last questions, either for Susan or myself. Happy to spend a little more time if anyone needs to, but certainly it's been a long day. We realize everyone's tired of Zoom. So, and I know a lot of you have been on a lot of these sessions. We really appreciate the effort you're putting into getting to know us. You know, in an ideal world, we would have done this on campus and taken you around to the different sort of parts of Yale so you could see what your community will look like. I mean, one of the things that, and you've heard this in the other sessions, that we really rely on also as part of our community, but also as the expertise and opportunities that exist in the other professional and graduate schools at Yale, in the other faculty, our other students. You know, somebody I think asked a question, I don't know if it was this session or earlier, about startups. And some of, in my time, I've been at Yale in sort of the student affairs end of it for 18 years now. And I've seen startups over the years, of quite a few of them, and they've often been the result of an engagement between a student in our school and a student in another professional school who have put their heads together and come up with a really unique solution to a public health problem. And those kinds of things are really organic and born out every year. So having people like Susan in our corner and our career development team and our faculty to help you have the experiences that you want while you're a student. And even in terms of the question about the internship earlier, you know, we're going to ask you to help develop the goals for yourself that you want your internship to meet. And so it isn't going to be something, you know, we're going to tell you what to do. You will come up with during, I mean, you may have them already, you know, and then Susan and the career management team and our faculty and our alumni, though it's a full-bodied approach, will help you get there. These experiences are all important in helping you earn your degree and then step out into the world. As one of our faculty says, and make us proud using our Yale MPH, your Yale MPH. So I'm sorry, I could go on and on about this all day. It's very exciting for me. And to have Susan, I've learned a lot, Susan. So thank you. Any last questions before we shut this down?
Well, there are a couple questions about the recordings. I know that you'll make them available,
Yes.
Mary, to everybody. And then also a question about a virtual tour of Yale, specifically our school. Do we have one?
Yes, that is, I'm so glad you brought that up because that's really lacking. And Yale is not allowing visitors. So we've been asked this question lately. Certainly the campus is open. You can wander around it at your leisure. I think seeing New Haven could be helpful. It's a wonderful medium-sized city, as Susan alluded to earlier. There is a session, I think, tomorrow night on life in New Haven. There are some student panels, but we have a wonderful foodie sort of atmosphere, great restaurants. So I don't even know where. So where am I going with this? I've been talking so long, I don't even know what I'm saying anymore. But so these videos are going to be posted for you to see at your leisure. Over the next few days, we will focus more on student panels so that you can get a sense of what it's like to actually live the experience of an MPH student and engage with some of the greater community, you know, not just in academics, but also in social and cultural events. There's lots of athletic intramural teams, so a lot of information to share with all of you over the next day or so. And Susan, I know I totally booted your question there, so where did you want me to end up?
I know, that's all fine. I'm actually going to put following us at oh wait, I think it's, sorry, I should know what our Twitter.
I know.
There we go. There it is. It's not at Yale. There it is. And then you'll see also our fearless leader, Rafael Perez Escamilla. Definitely check him out. He's an amazing leader, and really he has a lot to say about colonialism and really sort of our global perspective. So we are really, if you join us now, you're definitely joining us at an amazing time. We're really thriving, and I've been really excited to see where the school's headed. So I really hope to see you all in the fall.
Yeah, thank you.
But reach out if you have any other questions.
Thanks, Susan. Thank you all.
Thank you.
Thank you, everyone.
Thank you, Ryan. Thank you, everybody.
Thank you.
Great. What I can do too, Mary, is I could, if they have questions about the practice courses, I'm actually been lately struggling finding everything on our website, but I think it
Oh.
would be great to send them the link to the practice courses.
We just had a
And-
whole meeting. We just had a meeting with Frank Grasso and discussed that very topic. I've been surprised, especially this cycle since everything's online. And so there's been so many questions about how difficult it is to navigate that.
Yeah, so, and I know a lot of work has been put into it, so, you know, it's nobody's fault. I just
No.
think, and I just think that it's been, in order to go to the My YSPH, we've kind of lost some of the other stuff, but anyway, so,
Well, and you can't log into My YSPH unless you've got a
Yeah.
NetID and password. So things that are on there are not accessible to admitted students, which can be problematic for them. I understand the need to see the coursework, course descriptions. That came up in a meeting I was on yesterday. I think with Raphael, we had a meeting on the maternal and child health
oh, yeah,
track that he's going to be doing, which is so exciting.
yes.
Yeah, so I don't, if you want to provide a link, or I don't know how to sort of get
Yeah,
this out there.
I gotta figure that out, because I think that it's an internal link, so I'll figure that out, but I know that the students probably, the prospective students really would want to kind of see the badges. Is there anything I missed?
No,
that you would like?
really, Susan, I learned a lot too.
Oh, good.
You know, I worked in career services for years, so I know there was some tension early on with how these things worked, but there was always that applied practice requirement. And
Yes.
so, meeting that, and it's very clear now, and all of these support resources are very important for them. And so it's really helpful to have, these placements you have, and the work in New Haven is incredible and important. So thank you. I was
Great.
thinking as you were talking, I heard a lot of talk over the years about, the Office of Applied Public Health Practice was going to have placements, but they never did. So you've done a remarkable job. Thank you.
Oh, great. Well, you have my PowerPoint, so
Yep.
feel free to take it and share it and whatever you need to do.
Okay, thank you,
All right.
Susan.
Thank you. Have a good night.
Yep, good night. Any of you last people that are on here, if you have questions for me before I end the meeting, I'm happy to answer them. Okay, thank you all.